So how many bikes have been deployed and like which areas?
Actually, we have deployed 6 bikes dedicated only for the Narkasur festival. We actually, in total, we have 35 bikes, but out
Mhm.
of which 6 of them will be dedicated for the Narkasur festival for all the hotspots. For example, we have kept the bikes placed at Panjim, Mapsa, Porvorim, Ponda, Margao, and Vasco.
Uh-huh.
So, considering last year's data, we've kept in mind the last year's data where we had major incidents happening because the trauma cases and the vehicular and non-vehicular trauma cases during Narkasur last year increased by a good 80%.
Mhm.
So, because of that increase, we figured out the hotspots and we have placed bikes specially for those areas.
Okay, so these bikes are equipped with oxygen and there are
Yes, yes.
different, yeah.
These bikes are actually very well equipped to handle all kinds of cases and they give the first aid. And they have in that bike, we have a first aid box behind where they have oxygen cylinders, they have the cervical collars, they have splints in case of fractures, they have dressings for all the burns I mean, for all burn cases. And they can handle all kinds of emergencies like this.
Mhm. And also, if there are any serious cases, then what would be the action plan of the ambulance
Yeah,
bike?
the action plan for all the basically the bike ambulances were introduced into Goa for handling the platinum minutes. The first 10 minutes is a platinum minute. So if you can handle the patient in the first 10 minutes, you have a very good chance of saving the patient. So the purpose of these bikes are to give first aid to the patient, stabilize the patient, and as you said, if the patient is critical or if there's anything serious, then
Mhm.
immediately the ALS ambulance, the bigger ambulance will be rushed there and transport the patient to a nearby hospital or the nearby medical center wherever possible.
Mhm. So even I would like to ask you, like, how many cases or how many lives have you been saving through this bike ambulance or through your?
The bike ambulances have been doing a lot of cases in a day. See, we assign the bike ambulances only for trauma cases
Hmm.
because bike ambulances cannot shift a patient from one place to the other.
Hmm.
So they handle all kinds of trauma, road accidents, trauma cases, and all these kind of cases. So we place them mainly at all the highways and all the very prominent areas where you see a lot of accidents happening.
Hmm.
Okay, so we've been doing around, like for example, we've done 8 lakh cases for an ALS ambulance. So on a ratio, we must have done at least around 3 lakh cases for the bike ambulances.
Okay, so 8 lakh cases.
These
This
are for
data
the
is.
ALS. These are for the bigger ambulance. I gave you data.
Mhm.
So these are but there are various other cases. Like for example, if it's a fall victim, or if the pregnant lady, or if there is a heart attack, then the bike ambulances won't really be much of help. So we don't assign these bike ambulances for cases like that. We assign them for all the vehicular trauma, non-vehicular trauma, or first aid. If somebody's got a burn injury or something where a first aid can be of help, we assign the bike ambulances only for those kind of cases.
Mhm. So the bike ambulance cases are 3 lakhs.
Approximately, I'm giving an
Approximately. Okay.
average. Yeah.
So this data is from when? Like which year to which year?
For the bike, you're asking me?
No, both.
We started 15 years back. We very recently, in September, we finished 15 years.
Hmm.
So we are in Goa, in the state of Goa, under the leadership of Honorable Health Minister. We've been here for 15 years now.
Hmm.
And we've got various projects actually. It's not only the ALS ambulance. Sir, Honorable Minister has even introduced something like a cardiac ambulance, which is a very specific ambulance for heart patients. Then we have a different ambulance called a neonatal ambulance, which is for a baby up to 1 month.
Hmm.
So that baby, it's a very special ambulance. It's got an incubator and it keeps the warmth that a baby requires, the
Hmm.
temperature that is maintained. We also have a facility like a drop bag facility. So after delivery, when a lady delivers, after her delivery, after she's discharged, the mother and the baby, we drop them home free of cost.
Hmm.
So all these kind of projects have been introduced by our Honorable Health Minister, and our cardiac ambulance and our ALS ambulances we have the privilege of associating ourselves with the STEMI project that the
Hmm.
government of Goa has introduced, along with the stroke project. So in hand with DHS and our minister, sir, with the support, we are working with both these projects, which are a very, very important part, which has recently been introduced in Goa, the stroke project. So we are working with that.
Subscribe Prudent social media channel and press bell icon for latest notifications.